The following segment is sponsored by My Stem Cell USA. Our next guest is here with us from Utah Pain Relief Institute and My Stem Cell USA, Dr. Robert Bean, MD. Thanks for being here.
Thank you.
So I feel like in recent years you hear about stem cell therapy a lot more, but what exactly is it and what does it treat?
You're right. So stem cell therapy is becoming much more popular these days because we're realizing now that with the technology that we have today that really the richest, best source of stem cells is actually from your own body.
We have it in us already.
Crazy.
Okay.
So say somebody has a neck injury. We were talking about this a little earlier, and you want to heal it with stem cell therapy. You're going to use the stem cells from their own body and put it right back up there.
That's right. So we actually do a mini liposuction procedure. It's very non-invasive, but we just need to take a little bit of fat from the body. We have the specialized equipment in our office, in our lab, so that we can process those cells and extract the stem cells from it, and then use that to heal your own body.
So you take out a little bit of fat. There's no downside for this right now. This sounds great.
2 in 1. Yes. You're getting stem cells and fat removal. Why doesn't our body produce, like why wouldn't our stem cells be healing our cell? Why would we have to pull it from somewhere else and put it in our neck?
Yeah, that's a great question. We hear that a lot. Generally because these stem cells come from our bone marrow. However, as we age, it becomes depleted quite a bit. We don't have as much. Science recently has discovered that actually the fat in our body is the most richest area of stem cell produced in later stages as we get older.
Okay. Okay. And so what types of things can you treat? What kind of pain can stem cells do?
You bet. So probably the more common types of conditions we take care of are arthritis in the hip, in the knee, people who are trying to avoid a hip replacement or knee replacement, a lot of neck and lower back issues. However, we also can treat a lot of immune competency problems, so Crohn's or irritable bowel. People having trouble with COPD is a real common one. A lot of those autoimmune conditions.
Sounds like a lot.
Yeah, it can just cure just about anything, and it seems so incredibly natural instead of putting a plate or something in there.
It really is. It does take a lot of skill and understanding of how to deploy or how to inject, or we also send it through as an IV in order to help these patients.
But that's where you guys come in. You guys have all those skills and those tools.
What's the most common problem you're seeing that you treat?
Really, more than anything, I would say our knee, osteoarthritis of the knee. That tends to be the most common. It's ubiquitous around the entire area. People doing a lot of skiing, hiking for years and years and years.
Those dang knees.
Yes, they always will get you.
Yes. Does insurance cover it?
Unfortunately, this part, insurance is not covering stem cell therapy at this time. It will take a number of years as it goes through clinical trials, but that's one of the reasons we're here today is because our office is one of the few offices that are under an IRB, which is an established study with the FDA that allows us to track these procedures over time so that we can show the FDA that this is safe, that it is very effective, and therefore insurance eventually will start to jump on.
Be a part of the change.
That's right.
Yes. Okay, and you have a free seminar coming up. Tell us about that.
Oh, we do. It's this Wednesday, actually, at 1 o'clock at the Hampton Inn in Cottonwood. So we ask that you call our number. We'll show it here in a minute, but that number will allow you to register for the seminar.
Is it just where we can ask questions and learn more about stem cell therapy?
You bet. It is. It's just an educational seminar. We want to show people what we do, how we can help them, and show them the procedures so they can walk themselves through it and see that it's a fairly simple procedure.
Great.
Wonderful. Well, thank you so much, Doctor.
Thank you for having me.
Thanks so much.